My name is Betlem. I'm a third year medical student, or I just began clinical year. I would like to be a neurosurgeon, but I would like to learn abroad because the current teaching conditions in these facilities are very sad. And the number of teachers is very small.
Frankly speaking, it's better for me to work abroad to get that money. There is a problem of salary that's not enough for even basic needs in Ethiopia.
I think like most of other students, I plan at some point in my career to leave this country and engage in outside education. My sisters are also medical students abroad in the States, so I plan to go there and pursue my postgrad education there.
My name is Kiflam. I'll be graduating in 3 months. I'd actually prefer to go abroad because one, I'd get a better training, a better education, as well as better payment, honestly speaking. But as every Ethiopian doctor, hopefully, I want to come back again here so that I can serve the country and my people.
Voices of some trainee doctors at Ethiopia's biggest and oldest medical school in the capital, Addis. 4 out of the 5 students I spoke to were certain that they wanted to leave to work abroad as soon as they could. They cited issues with salary, training opportunities and working conditions, and it does seem likely that most of them will end up taking their expertise out of Ethiopia.
Some of the students I was speaking to said that the working conditions are very difficult in hospitals here. Do you know why that is?
Yeah, actually in government hospitals, it's very difficult to work, and I don't want to work in government hospitals. You can't help patients. You just know the diagnosis, you tell them, but in most of the cases, you just don't really help them. So you see the patient dying in front of you without doing anything. Equipment from the syringe, from gloves to the basic antibiotics. Most of the time, the hospital is out of stock. We give them prescription to attendants, they buy it outside. That's how it is on average day, working in government hospitals. It's very frustrating. When I was in one hospital, I was in the gynae obs ward, and there were only 8 beds for laboring mother. And usually per day, on average, almost 20 or 30 mothers come to deliver. Once even, when all the beds are full, we usually refer them, even if they are in second stage, almost delivering the baby. It's very frustrating. So, it's difficult to work just in the government hospital. In order to make a living, they have to work in 3 to 4 places. So it's very tiresome, and it's also demotivating.
How urgent do you feel the problem is? I was quite struck talking to 5 medical students that they were all very patriotic, they were all very determined that Ethiopia should have a good health system, and yet 4 out of the 5 were all saying as soon as they've served out their time that they have to stay here after graduation, then they will be leaving. But if so many are so determined to go, how can you ever compete to get them to stay?
4 out of 5 from what we have, it's painful. The reasons for their departure is too many, and we're addressing many of them, and that figure will change. If you produce enough, I don't think 4 out of 5 will be on the move. The strategy we're following is flooding strategy. We consciously overproduce. For instance, since 3 years ago, we have more than quadrupled our enrollment from 250 to 1,250 or 1,300, which is really big in terms of where we were. And in the next 2 to 3 years, we will increase our enrollment up to 4,000. Now, not more than 200 graduate every year. If you lose even one person, it's painful. But when we start graduating 2,000, 3,000, 4,000, even if you lose 1,000, would be okay. So it's a supply and demand problem, and we have to address it that way.
But these attempts to dramatically increase supply are already creating some problems of their own.
Our class, we're the first batch to be, our number is 360. Normally, it was supposed to be 60 students. So even in our class, there are some students who sit on the grounds one. And the other thing is there aren't enough books in the libraries. The other is the staff members are overwhelmed by our number. The number of students and patients is equal, and the number of teachers is very small. So we don't really learn anything. We simply stand at the bedside and stare at the patients.
No one knows exactly what proportion of this increased number of trained doctors will decide to stay for good. It's not just the pull factors like the money they can earn abroad that attract doctors. There are push factors too, reasons that put them off working in hospitals here.